Okay, today I want to talk about PCOS, a poorly named disorder. Okay, so PCOS stands for Polycystic Ovarian Syndrome, and it is a very common diagnosis that I'm seeing more and more of. And it's honestly one of my favorite type of diagnosis to work with because it is incredibly, I'm not going to say easy, but it is incredibly possible to treat and to get pregnant without having to do IVF. And that's the big takeaway I want you to have, is that PCOS does not equal that you are going to have to do IVF, okay? So it can certainly make getting pregnant more complicated. That is true. But that does not mean that you cannot get pregnant if you have PCOS. It usually just means that we need a more targeted strategy for you if you have that. So, let's dive in, okay? So this is, again, one of the most common causes for infertility, and it is one of the most treatable. So let's talk about what it is. So PCOS is not just a hormone issue. It is usually a metabolic disorder and an inflammatory disorder that shows up as a hormone issue. So what does that mean? It means that hormones are going to be the symptoms. We're going to see that you are more prone to hair growth where you don't want it. You are going to be more prone to weight gain and acne. You're going to be more prone to a slower metabolism and insulin resistance and inflammation. These are going to drive that diagnosis. So if we only treat the symptoms, we're going to miss what's driving the problem, right? So if we just treat you with like birth control to control those symptoms, it may make some of your symptoms like the unwanted hair growth and things more appropriate, but it's not going to fix the underlying driving issue, okay? So the biggest reason that PCOS is negatively impacting your fertility is because it impacts ovulation. If you are not ovulating, you cannot get pregnant. And what we see with people with PCOS is often their cycles are a lot longer than they should be. They're very irregular, or they're more likely to have anovulation, which means that they're not actually ovulating. So you can ovulate late or not at all, and it's really difficult to manage timing when we have really inconsistent ovulation, okay? So ovulation is important, but the strength of ovulation and the quality of your ovulation is also important, okay? So let's talk about the first things first. When it comes to PCOS and getting pregnant, the first thing we need to know is, are you actually ovulating? Regular cycles don't always equal ovulation. So what we want to do is confirm ovulation is occurring with labs and with cycle tracking, okay? And we want to, usually when I start working with clients, we start seeing that cycles are going from like 30, 60, 90 days or not having them at all to more consistent cycles, thus more predictable, okay? So first thing is going to be ovulation. The second really huge thing, the biggest driver that I feel contributes so much to PCOS, is going to be blood glucose and insulin. So what we need to do is really make sure that we are keeping blood glucose levels stable as possible. And what that means is that we are not consistently going from like a blood glucose of 80, meaning we're, managing things well, or we haven't eaten in a while, to like 160 to 100 to 180 to 140. Like we want it to stay consistently between that, usually like 85 to 120 marker, we'll call it that. Okay. So the way that we measure this is with blood glucose is going to be a blood draw. And so a CGM, continuous glucose monitor, I'm sure I've talked about this before on here, is my favorite tool to use, especially with a client that I'm just starting with, that we want to really understand what foods are impacting you, what can we start changing to get better outcomes, okay? The third thing that is really important when it comes to managing PCOS is going to be inflammation. And inflammation is challenging because a lot of times you don't realize that the symptoms that you're having are abnormal, and you don't realize that the symptoms that you're having are indicative that we are having inflammation somewhere in the body. Okay, so doing an inflammation assessment can be really helpful to kind of determine where we need to dig a little bit deeper. Okay, supplements and medication make a huge impact for people with PCOS. Okay, so certain things like myo-inositol, omega-3s, sometimes metformin can be a really beautiful tool. Sometimes berberine, depending on what's going on, can really help, but only when used intentionally. A huge mistake that I also see, especially, well, not necessarily especially in PCOS clients, but and just clients in general, are that people are taking so many things that your body is kind of getting missed signals now. We've got one thing that's saying this needs to go up. We got another thing signaling that this needs to go down. And so now we're kind of leveling out and we're not seeing the improvement that we want to see. So we want to get you on proper supplementation based on lab works, based on your history. And if we have something else going on besides PCOS and besides insulin resistance, that may change depending on you. Okay. And then a semen analysis. It's always important. When we are working with somebody with PCOS, I still want to know what the semen analysis for your partner looks like, because we want to work on both partners. It takes two to make a baby. And so we want to make sure that both partners are doing what they need. So I think that that's also really important. Just because you have PCOS doesn't mean that we don't need to work your partner up. Okay. So because sometimes there's room for improvement there too. So the good news is that there is a lot you can do on your own to really manage this. And my course, Get Pregnant Faster, really goes into all of this, especially for people with PCOS, because it's such a, again, it's not easy. It's such a treatable disorder. Okay. So, what the main things we focus on in the course are, and when I'm working with clients one-to-one, is blood sugar balance and finding out what works best for you. And that may mean kind of changing what you're eating. It may mean pairing things a little bit differently. For instance, like I've got a client right now that like her usual go-to is just grabbing a piece of toast out the door with some coffee. And we're really not getting any fiber or any protein first thing in the morning. So we're working with her to kind of switch things up. I understand that having a piece of toast with avocado and an egg is more calories. But here's the thing. The way that this impacts your blood glucose is completely different by what you're adding together. So that's a critical step. Often high intensity interval training, strength training, movement in general, walking after meals, especially for about 10 minutes can really help with that blood glucose absorption, and that can really empower things and change things. Sleep is critical, especially, well, for all my clients, but for PCOS, we really want that rest and reset to be able to allow your body to do what it needs to do to repair itself while you're resting, because that is what sleep is for. So prioritizing sleep. Ovulation tracking, or at least cycle tracking, to kind of better start understanding when is going to be your optimal times for getting pregnant, because that is going to change after you start making these changes. If your cycle is very consistent, then I don't expect to see a whole lot more. We might see like signs of a stronger ovulation. We might see that ideally what we're doing is going to see that your cycle is starting to become more consistent and thus more predictable. Okay. And that is a great sign, because your cycle is like another vital sign. It is a indicator of what is going on with your body specific to your reproductive organs. Okay. So ovulation tracking, cycle tracking, all that's important. Reducing inflammation, that is going to be individualized based on what your history is, what your needs are, etc. And then targeted supplementation. So it is not about doing everything perfect. It's about getting really strategic, and kind of putting all those pieces together a little bit at a time. Okay. So, a lot of times women with PCOS are kind of come to me thinking, I just need to try harder, or I just need to work out more. And that is very rarely what needs to happen. Okay. It is not that you need a stricter diet. It is that you need a tailored diet. You need something that's going to work for you. If you're going to tell me to eat cottage cheese every day, I'm not going to do it. I think cottage cheese is gross. I'm trying to like sneak it into stuff now because, it's good for you, and maybe I can eat it in pancake or like in a pasta, kind of acting like a ricotta cheese, but I'm not going to eat curd ricotta. I can't do it. Okay. So if I tell a client to eat that, they're not going to eat it and they're not going to see the progress. So my goal is to figure out where can we make some changes that actually support your diet and support your nutrition. Because if I tell you to eat something that you're not going to eat, it doesn't matter. And I don't want you to have something that you eat for the 4 months that you're working with me. I want you to have something that you can sustain through pregnancy and postpartum, etc., because it's all really important. It is not always about more supplements. It is about the correct supplements. Okay. Supplements, we can go way too overboard. They really need to be targeted and tailored to you and your needs and your labs and your history. Okay. More stress. Gosh, if you think like, God, I just need to work out more and eat better, like that starts to be very stressful. So, managing stress appropriately, finding that way to safely manage stress is really important as well. And we don't need more guessing. We need more solutions and more answers. So we don't need more. A lot of times what we need is to kind of just shift things so what you're doing is actually working for your body and not against it. So PCOS can 100% make things regarding getting pregnant feel more frustrating, but it's not a dead end. It is honestly, again, it's one of my favorite diagnoses to help because I do see such incredible changes and outcomes with my clients that have PCOS. I don't think anybody that has had, no, I don't think I've had anybody so far that had PCOS that ended up having to go through IVF solely for PCOS. There can be other issues, anatomical issues that may be a factor that have nothing to do with PCOS. But usually we can get things very tightly controlled and you can get pregnant with PCOS. So with the right strategy, this is something that can help really improve things significantly. I've had clients who do the GLP-1, so Ozempic or tirzepatide, or I can't even think of all the different names for them now, that if we need to really cut back and help with that insulin resistance and really help with the inflammation, that can make a huge difference. And so that's not really safe to be on while you're pregnant, and we really want you to discontinue that 2 months prior to trying to conceive. But that can make a really big difference. Now, I know a lot of people don't want to do that, and that's fine. I'm not here to tell you that you should or should not do that. I want you to know what your options are so that you can make a good decision that is smart for you and for your body and with your healthcare team, and so that you can ask the right questions on, am I a good candidate for this? Why or why not? What can I anticipate seeing? What can we measure to chart my improvement? That's also covered in the course with some checkouts or some checklist of like ways to measure and things that you can start monitoring to see, are we noting improvement or not? So again, main takeaways: PCOS is often a metabolic and an inflammation issue that is showing up as a hormone issue. Ovulation quality matters, and you do not need to try harder. You need to have a strategy. So I hope that this was helpful. I'm Katie. I'm I'm a fertility specialist and a nurse practitioner that struggle with infertility and recurrent miscarriage. And now I hope other people navigate this so that they can have an easier path, hopefully, than what I did. So yeah, I hope this was helpful. Drop any questions below. If you've got any topics that you would like to see or hear about, I'd love to accommodate that. So see you next time.